Why do we need an obesity clinic?
A clinic specifically dedicated to obesity is needed because obesity is not just about numbers, it's just not about the excess weight. It involves a lot of other things. So an obesity clinic basically has a nutritional evaluation, a hormonal evaluation, a metabolic evaluation, evaluation from the physiotherapist's aspect, behavioral evaluation, and then we set the numbers, the targets, and the way to reach it. So it is just not about, a crash course or a diet. It is about a holistic approach towards obesity, where you're treating the biology behind obesity and not just the kgs in numbers.
So, when is pharmacotherapy actually required for treating obesity?
So pharmacotherapy or anti-obesity medications are required for those people who have tried lifestyle measures for a significant period of time, say 3 to 6 months, and have not succeeded, and have a BMI of more than 30 or a BMI of more than 27 with comorbidities like diabetes, hypertension, dyslipidemia, sleep apnea, or fatty liver. So this is an area where this is the cutoff where anti-obesity medication may be introduced along with lifestyle changes.
Is everyone living with obesity a candidate for anti-obesity medications?
No, certainly not. So when we assess a person with obesity, we have to look into various aspects. Now, we must remember that these are not quick hack methods. If you intend to take these anti-obesity medicines for 2 months or 3 months or 4 months, then it's not going to help. It's a chronic disease. The biology behind the obesity has not gone away. So if you stop the medicine, then the weight tends to come back. You have to remember that like you take your medicines for diabetes, like you take your medicine for hypertension, so these medicines are also chronic medicines. If you intend to go ahead with short-term, course of these medicines, it's not going to help. So yes, these medicines have to be given continuously. So a person who intends to take this medicine has to take this for long. Number 2, we have to assess whether the person has any contraindications for taking these medicines. There are a number of contraindications. Your endocrinologist will be the best person to tell you about that, to assess that. Also, we need to look into the psychological aspect, whether the patient is fit, or the person with obesity is fit to take that medicine psychologically, can continue with it. So there are various kinds of assessments that need to be done before initiating an anti-obesity medication.
Are there any side effects associated with anti-obesity medications?
There are side effects. Initial side effects are generally gastrointestinal for most patients. It's not like everybody is going to have side effects like in any other medicine. So there might be nausea, there might be vomiting, some people might have constipation or loose motion. There's this sense of fullness, which is actually a part of its action, but it kind of causes a little bit of inconvenience to a lot of people. Generally, this is dose-based, but after a period of time, say around 3 weeks or 4 weeks, people generally get accustomed to it, and the side effect, the intensity of the side effect generally tends to come down. There are also concerns about long-term side effects. Now, we must know that we've not had these medicines for a very long time, but whatever we have data with as of now is based on studies which were done for 3 years or a little more and follow up a little longer. So there were some concerns about the vision, about some problems in the eye, but they have not been seen to be very, very significant. However, our patients are told about these problems, that if they have, vision problems, if they have severe abdominal pain because there are mild concerns about pancreatic problems, or they have, severe gastrointestinal problem, then they must report back immediately.
There are concerns about muscle mass loss. How significant are they?
We must remember that when a person loses weight, 2/3 of the weight loss will be fat, but 1/3 will be muscle. So that is why we must remember that when you're taking these anti-obesity medicines, you must be careful that you must be adding on enough of protein to your diet. Also, resistance training, specific resistance training, which have to be taught, which have to be learned. These are not things, these are not hack methods. So you have to learn it from the physiotherapist or from someone who knows it. Proper resistance training and adequate amount of protein intake in the diet is very, very important when you're using these anti-obesity medications.
And once medications are stopped, does the weight come back?
See, it is a chronic disease. The biology behind the weight gain has not gone away. And what also happens is that when a person loses weight, the body perceives this as famine and has a tendency to bring back the weight in, always possible. So that can be by increasing the appetite or, changes in the BMR. So a lot of ways the body tries to regain the weight. So that is why if you stop the medicine, you will gain weight, definitely. So you must keep in mind that you have to continue this medicine chronically. We do not know for how long now, at least for 1 to 2 years, you have to continue this. When you stop it, some amount is going to come back, and whether you can maintain that with your diet and exercise. And again, your requirement for your diet control and your exercise is actually going to be more in the maintenance phase than what you do in the weight losing phase. So yes, the weight will come back. You must be prepared for that. Do not go ahead with, short-term courses. It's not going to help you. So be prepared for a long-term therapy. These are expensive drugs as of now, so that is a major concern. But hopefully the cost is going to come down in some time. We are going to see a reduction in the cost, which will make it more accessible to more people. But again and again, we'll say that remember, obesity is a chronic endocrinological disorder. It is not a short-term course that you can do. Do not go ahead with short-term dietary hacks or short-term courses which are not going to be useful in the long run. So the treatment of obesity is not a shortcut. It requires a holistic, multidisciplinary approach which involves endocrinologists, nutritionists, physiotherapists, and a continuous support from a combined team, which might also involve psychological support. So if you're not able to reach your targets by yourself, do not get demotivated. Reach out to a proper team who will help you reach your targets in a scientific, sustainable manner.